Hello, everyone. Good afternoon. It's nice to see you all. We are going to give people another 2 minutes to join and then we'll get started.
Hi, Monica and Erica. Can you guys hear me?
Hi, Sharon. Yeah.
Is anyone? Oh, you're talking now. I was like, I can't hear anything. Is anyone talking or is it just me?
Oh,
okay,
no, we were
you.
giving it one more minute.
Okay.
All right. Good afternoon, everyone. Welcome. My name is Erica McAllister, and I am the School Health Services Liaison with the Nevada Health Authority. And thank you for joining us for today's first multidisciplinary information session. These sessions are going to be held monthly to bring together school staff, administrators, and providers across Nevada's schools. Our goal is to provide practical guidance, share expertise, and answer any questions so that everyone feels confident in delivering services, documenting correctly, and billing Medicaid accurately. Today's session is an introduction to Medicaid in school health services. We'll start with a presentation and then open it up for Q&A. These sessions are meant to be interactive, so please feel free to participate. And before we begin, just a quick reminder that this session is being recorded so that we can post it on our website for anyone who wants to review it or share it with colleagues afterwards. During the Q&A, you can raise your hand in Teams and we'll call on you, or you can type your question and comment directly into the chat. I'm very excited to have Monica Schiffer, the External Stakeholder Chief for the Nevada Health Authority, with us. She has been with Nevada Medicaid for nearly 10 years and oversees the School Health Services Program and will be leading us through today's presentation. And with that, I will turn it over to Monica.
Thank you so much, Erica. Good afternoon, everybody. Thank you so much for joining us for this inaugural multidisciplinary information session. I'm so glad to see everybody here. I am going to start by saying Erica has assured me, even though I have never done a PowerPoint presentation via the Teams way before, that it's going to be very easy and very self-explanatory. So if it's not, y'all just bear with me and I'll figure it out. So again, my name is Monica Schiffer. I'm the External Stakeholder Chief for Nevada Health Authority. I started with the state in 2010 at the division of what was then the Division of Welfare and Supportive Services, came over to Nevada Medicaid, the Division of Healthcare Finance and Policy, back in 2016. And now I am with the Nevada Health Authority. I have been working in the school health services policy for about 2 years, but I would never have been able to get as far as we have gotten without the support of our Deputy Director, Dr. Melinda Southern, and without Erica coming on board just just about 10 months ago, and just the work that she's been able to accomplish in those 10 months has just been fantastic. But so I am going to go ahead and get started. Okay, I'm hitting present in Teams. I'm about to present. I'm sorry, you folks, I really should have practiced this. Okay, perfect. Thank you so much. All right, so today, quick agenda, we're going to have an overview of Medicaid, as Erica explained, go into some of the school health services program, what the implementation in schools looks like, and then we're going to open it up for questions and answers. Also, again, as Erica said, please feel free to drop any questions in the chat, raise your hand as necessary or needed, and she will be paying attention to that while I go through the slides. So the first thing is, what is Medicaid? So Medicaid is a public health insurance program. It is primarily for low-income individuals. It's funded by both the federal and state government, and covers children, families, the elderly, and people with disabilities. It is the largest payer of healthcare in the United States. And unlike Medicare, Medicaid is based on income and other eligibility requirements. Every state administers their own Medicaid program. So if you move to Nevada from Colorado, from Maine, from California, and we're used to seeing one set of benefits in that state, that doesn't necessarily translate to Nevada Medicaid, because there is a requirement for some. There's the required services and then there's optional services. And so every state can determine what optional services they cover based on their budget, their population, their own needs in their state. So that's important to remember, is that every state's Medicaid program will be different. So when it comes to Medicaid for our students at school, a lot of children do qualify for Medicaid or the Children's Health Insurance Program. The Children's Health Insurance Program is a program where if a family is just above the income levels or income limits for full Medicaid, a family can pay a portion of that fee. There would be maybe a quarterly cost to still get the benefits of Medicaid for children. The income requirements for kiddos is more generous than it is for adults, I will say. So it's always best if somebody's like, well, I don't know if I would apply. Always apply. We always tell everybody, just look at it, because you never know. It's better to try, and if they're covered, that's fantastic. So Medicaid covers medically necessary services for kiddos. One of the things that's different in schools than it is out in the community is community providers for a lot of services have to request what's called a prior authorization. And in our schools, we do not require that. The school, as long as they can document their medical necessity and it's something that is covered, they can just provide those services. EPSDT is a critical Medicaid benefit for children. It is the early and periodic screening, diagnostic, and treatment program, and it makes sure that preventative, diagnostic, and treatment services are covered. And this includes the services that can be provided in schools, as long as they are medically necessary and allowed in the Nevada Medicaid state plan. The state plan is the agreement that Nevada Medicaid has with the Centers for Medicare and Medicaid Services, which is our federal oversight program. And that basically is the agreement that we have of what we offer in this state through the Medicaid program. What we are doing with our school health services is wanting to support healthy development and school readiness for our children in Nevada. So school health services is what we call Nevada's school-based Medicaid program. And it allows our local education agencies, or LEAs, to bill Medicaid for covered services that are provided to eligible students. We do need to ensure that the services are medically necessary and documented properly. What's important about school health services is a lot of the services that the schools are getting reimbursed for, you're already having to provide to students. And so by billing Medicaid, that helps put a reimbursement mechanism in for services that you would have to be providing anyway. Some of the services that are allowable under school health services are nursing services, speech therapy, counseling. So we want to ensure that all of the LEAs in Nevada know what can be reimbursed and that this is a benefit to the districts. So our goals for the school health services program is to increase access for health services in schools so that we can support these children to have their best health outcomes, which is just going to improve their learning outcomes. And we want to ensure that we're leveraging federal funding for sustainability. We really want to ensure that our school health services program aligns with our public health and education goals and expands access to care while supporting our whole child well-being. So Medicaid in schools, you can be reimbursed for students that are on Medicaid with no IEP or 504 required because we are in an expansion state in Nevada. You can be reimbursed with students who are on an IEP or 504 plan, and we do require parental consent. Just one talking point that is often brought up when we're talking about consent, when someone applies for Medicaid, that is their consent for claims to be billed to Medicaid. The bigger consent piece is, of course, the consent to share data, which is the FERPA side of things. So just keeping that separate. So just wanted to make sure back in 2019, I think it was, Nevada expanded school health service outside of IEPs. And then 2020, we all know what happened there. And so we've really been working on trying to help expand our services that we provide and expand the assistance that we're providing to the local education agencies, trying to be more open to hearing the needs of the LEAs. And I think that we're all moving in the right direction there. So this is just a reminder of those services, again, that can be reimbursed. We've got nursing services, behavioral health, therapy, assessments and evaluations, dental services, and assessments are not limited to IEP eligibility. They can support early identification and medical necessity documentation. You can get dental services reimbursed when they're provided in schools, preventative care, minor treatments, as long as it's being provided by the appropriately credentialed professionals and is allowable in our school health services policy. It's something that can be provided in the schools. And again, all towards the healthier outcomes for the students to be able to manage their classroom time and their school time. So Medicaid enrolled providers working in schools can provide services, and those types of providers include school counselors, social workers, school psychologists, the school nurse, board certified behavioral analysis, physical therapists, occupational therapists. Those are kind of the main ones, but there are several others, and we are happy to discuss that. So in order to implement Medicaid reimbursement at a school, the providers doing the service do not need to know what a student's insurance status is. That's not something that a provider would need to know. That's happened behind the scenes. So the services are provided whether or not a child is on Medicaid, whether or not there's going to be a reimbursement. So the administrators determine which students are Medicaid eligible. They would secure parental consent and a release of information to be able to bill Medicaid. Make sure providers meet those qualifications, document and submit those claims, and receive reimbursement. So starting to work with Nevada Medicaid for reimbursement of your claims can be small. You can start with just your IEP students. You can start with just your nursing services and build from there. It doesn't have to be an all or nothing scenario or situation. So one of the benefits is that school health services can bring in new funding to support existing staff or expand services. There's better access to services. We are working on having a good partnership between our education and our healthcare services in this state. It supports access and equity by helping students get care where they are, and most of our kiddos are at school. And also school services can work with community providers so that there's collaboration and that the child is getting what they need both at school and in the community. So the School Health Access Resource Center is something that Eric has been working on for several months. It has a lot, I hope that most of you are familiar with that. It has a lot of great resources. It's updated monthly. She's got all of the information about the trainings. She's got information about the monthly meetings that we have, the open calls that we do, the office hours. And it is at schoolhealth.nv.gov. And also you can reach us at schoolhealthservices@nvha.nv.gov, or through our individual emails as well, whatever works best for you. Looks like Erica's dropping those links in the chat. So that's just a very, very high level overview. I've worked for Nevada Medicaid since 2016. And I still almost every day am looking things up and asking questions because it is just such a mighty beast. And when it's a mighty beast to me who works in it every single day, it is, I'm sure, King Kong to some of our LEAs who you didn't get into education to bill Medicaid. And so we are working towards having resources and having accessibility to our team and to our knowledge about Medicaid to just support the LEAs that are trying to expand their services and get services to kiddos to help them be better equipped to manage their school days. So if I missed anything, Erica will jump in, but is there any questions that we can help answer? Please check out the resource center. Like I said, it's updated all the time. We have a guide in there that we update semi-annually. I'm looking for Erica to nod at me. Yes. And I just want to say that I appreciate the collaboration and the relationships that we have been working on and building, and I appreciate the input that we get from all of the LEAs. It really helps us to look at how we can improve our school health services. We might not be able to do everything. We are, of course, limited by federal guidelines, state guidelines, and budget, but we appreciate the fact that we even can come to the table and discuss all of these things with you. And we're actually going out in the fall, and we'll hopefully see a lot of you folks in person. But I am going to leave up our contacts here. Are there any questions in the chat or any topics anybody has that they'd like to bring up while we've got you here? Okay, how about,
We have a question in the chat. Nancy Coolis says, how can a school district sign up to have you visit them?
so great question. Thank you so much. We try to go out to the districts annually. And so we start reaching out. I would say Erica started reaching out in June to work on the fall schedule. And so that's something that we try to do annually is go out and meet and see, okay, since the last time we were here, what have we done right? Or what are some challenges that are still there? What else would you like to see? But if there are some one-offs that a district is like, we are really struggling with this, we really need help, you could reach out to the school health services at nvha.nv.gov and say, hey, what opportunities are there for some support? And we are happy to do whatever we can to provide that support. Okay, so it doesn't look like we have any comments. So I'm going to ask this. Since this is our first information session, and it was just kind of the high level Medicaid 101, how do you folks see these going? Do you think these are going to benefit you? Will you be able to share them with team members and say, hey, if you go to the resource center and you see what's coming up, documentation, would you share these with some of your providers or your other staff members that you think that this could be beneficial for those people?
This is Naomi from Elko. I've already shared them with all of our providers so that if they feel like they need more support, they can get on and join on these meetings as well.
Thank you, Naomi. Thanks for that feedback.
We, of course, share everything and we know how to get a hold of you. So.
You do. Yes, right. Thank you, Monica. Well, yes, I believe Erica is posting both the PowerPoint and the recording to the resource center.
Yes. I would be curious to ask folks if they're willing to come off mute, maybe raise your hand. That way everyone doesn't start talking at the same time, and introduce yourself and say where you're from, whether it's an LEA or you're a provider. We'd love to see who showed up. Sharon.
Sharon Dickinson, Clark County School District.
Thank you.
I'm an
Naomi?
LEA, of course.
Thank you.
Naomi, I'm with Elko County School District, the Medicaid Secretary.
Thank you. I see Sarah.
Sarah Hannanen, I'm from Pershing County. I'm their MTSS coordinator.
Awesome.
Wonderful, thank you. I saw Cynthia raise her hand, actually, if you want to.
Hi, everyone. Introduce myself, Cynthia Floyd Runnan, and I did used to work for the Department of Social Services, so Medicaid billing's right up my alley. I actually love doing it because I heard what you said earlier about joining the school district.
You want a job?
No, I have a job and I really do love it. So. But this information, Medicaid 101 was just awesome presentation. Thank you. Thank you, Monica and Erica.
Thank you.
And hi, Monica.
Hi, Cynthia.
I got to meet Monica about 2 weeks ago. What a lovely, lovely lady.
Cynthia's rocking it at NIE. I'm so proud of her. You've done an amazing job. So
Thank you, sweetheart.
Awesome.
Well, Monica Romero, I saw your hand up as well.
Yeah,
She
so
was
I'm
waving.
Monica Romero. I'm the School Health Services Statewide Coordinator with the Nevada Department of Ed. We have other colleagues here with us as well.
Thank you. Katie?
Hi everyone, Katie Metz. I'm one of those colleagues with Monica. I'm at NDE Australia as a contractor under our school-based mental health and AWARE grants.
Karen?
Hello, I'm Karen Mertz, and I also work in Nye County, and I work with Cindy.
Thank you. Melinda?
Hi, everybody. Melinda Southard, Deputy Director for the Nevada Health Authority for Community Engagement and Workforce Development, and just super proud of this amazing team. Monica and Erica are doing an amazing job, and so are all of you. And I'm just really excited to get to see most of you, hopefully, coming up this fall. And I really appreciate all that you're doing. It's a great group.
Thank you. Nancy? Poulos?
I'm Nancy Coulis, and I co-chair a statewide, it's the NVHA Coalition to Address Personnel Shortages, and our goal, it's the new group that's coming on billing Medicaid, so school-based counselors, psychologists, and social workers supporting them as they navigate Medicaid in the schools. And so we support all those, the therapies, and then we are targeting and focusing on recruitment and retention of these practitioners in our schools. And happy to be on this group.
Thank you. Lori? Oh, we can't hear you. You're more than welcome to say hello in the chat if your microphone's not working, or we can try again in a few minutes. Okay, let's see who's next here. I see Candace.
Hello, thank you. I'm Candace Bordelin, also with the Nevada Department of Education and supporting school health services.
And Angie.
Hi, so I'm Angie Nasso, and I'm with Nye County School District, and I am the district nurse.
Thank you. Okay, it looks like Lori put in the chat. She's Lori Bauman with CCSD, that's Clark County Health Services, supporting school nurses and health office staff. Thank you. And it looks like Karen's hand is still up.
Karen. Oops.
I see lots of typing. Thank you guys for introducing yourselves. It's nice to see your faces and see who's here. We're really glad you're here. All right. Well, I see some typing in the chat, so I'll give it a minute. But I wanted to thank you all for coming to today's first monthly multidisciplinary information session. Our next session is scheduled for September 15th, and the topic will be covering FERPA and HIPAA, which Monica mentioned a little bit earlier. And I hope that you guys will join us for that presentation. And if you do come up with any questions or concerns or have any feedback for these new webinar series, please email us, reach out. We love to hear from you and help you guys. And so on behalf of Nevada Medicaid, thank you again for all the important work that you guys are doing with our students in the state of Nevada. And I hope to see you guys at the next session, and have a wonderful rest of your day.
Thank you.
Thanks, everybody.